Hi, everybody. So I'm going to start out with one of those perfect days that sometimes we have in Nebraska. So 30 years ago, this is my firstborn, Joey on the right, sitting next to his two cousins one was born a few days before and one was born a few days after. So what an amazing time for me. I was 26 years old in the middle of a PhD program and welcomed my first son. Little did I know there was something wrong with Joe. Something just wasn't right. He wasn't gaining weight. He was battling colds from just the first days after he was born. And so his diagnostic odyssey started just days after his birth. Little did I know, and I probably wouldn't have had him sitting on the ground, sitting next to other babies, he had the bubble boy disease. So on the left is the iconic photo of David Vedder, who was born with severe combined immune deficiency. SCID is fatal if it's not treated in the first year of life. And again, I'm probably smiling more than I should have been at that time, but we were lucky in the course of SCID to get a relatively early diagnosis. Because as I click through these pictures 30 years ago, we often, with children with immune deficiencies, spent over a year in the hospital. So you can see Joey's first year as he wore different clothes for 4th of July, Halloween, Christmas, and his first birthday. But we were very lucky. We got a relatively early diagnosis, and being in medical genetics, I knew how to do a literature review. We were able to go to a transplant center. We were able to get relatively early care. So with Joey's treatment, we thought our family is back on track. We've got an immune system. We left the hospital with just half of an immune system, but we thought we'll take it. But once we got home, Joe continued to have some developmental concerns, and because of all the medical procedures and the infections, so when he was sitting next to his cousins, I didn't know he already had 6 bacterial and viral infections attacking his little body. So once we got home with half an immune system, we saw some developmental delays, we actually moved across the country again. And that move across the country, I was able to continue my PhD studies and actually be part of the Human Genome Project. We were in sunny California, and they provided some early intervention for kids like Joey in those days. So I was very lucky. Because of my work in the human genome and some early ideas I had about how to combine informatics with genomic variants to help us understand diseases, I was appointed to a federal advisory committee on heritable disorders in newborns and children by President Bush. This was my first introduction to the newborn screening system, and a light bulb went off. I thought, what an amazing opportunity to pre-symptomatically identify newborns, treat early before those consequences, before the loss of muscle, before the first infection, before the loss of brain cells. Let's do something early. Let's leverage this population-based screening. And so for the last 13 years, I've been part of the American College of Medical Genetics and Genomics, leading a key initiative at NIH called the Hunter Kelly Newborn Screening Research Program. Another president, other than President Bush, President John F. Kennedy, called on NIH to create the Eunice Kennedy Shriver National Institute of Child Health and Human Development. And for the last 15 years, they've funded ACMG to advance discoveries in newborn screening. So I've been really excited to be part of this group and to run a team that has really worked to advance novel discoveries in screening, diagnosis, treatment, and management. But what I've learned through my personal experience and my professional experience is that it doesn't end with screening or a diagnosis, that we have to make sure that we take care of these children and families throughout the life course. And I think I made this little picture of Joey's first years. So when you look at the report, amazing report by the EveryLife Foundation, for SCID it's a little bit different. If we can identify in those early days after birth that there is an immune deficiency study, we can do a whole lot in the beginning so that we can actually replace that immune system. We can avoid the infections, we can avoid the neurological damage, we can avoid all the other consequences of this disease if we intervene early. So this picture might only have a few icons on it. So in closing, I realize I'm so lucky. This is Joe with his two twin siblings, and our story is unique. And again, we're so fortunate. But the medical costs for rare diseases, as we've all heard earlier, are inevitable, but they're avoidable. Joey's delayed diagnosis is today avoidable, but the care and diagnosis and management of children with SCID is not covered. We mandate newborn screening in the United States, but we don't mandate care. And so we really have a lot of work to do, and I'm so glad to be here today and have this unique opportunity to impact the lives of every newborn born in the United States, regardless of geography, economics, and the parents' and community's ability to take care of them. So thank you so much for the opportunity today.